A new 20-minute medical procedure to help with alcohol cravings is now available right in our own backyard. And the doctors from Sober Time USA are here to tell you all about it. Let's start with Ernesto Galvan. Ernesto, it is so great to have you on the show. How are you?
I'm fine, Dave. Thank you very much. How are you?
I'm great. It's actually really exciting. I'm looking forward to talking about this. So the floor is yours. Sober Time USA. Tell us about it.
Sober Time USA is a program for the alcohol-dependent person. People come to us because they're unable to stop drinking on their own. What we offer is a bioabsorbable pellet. It's placed subcutaneously. We offer that simply because it helps the patient achieve something they're not able to achieve on their own, which is if they were to use pills, they have a choice to stop taking them. There's also an injection. We like the pellet because it's there 24/7. It gives a constant therapeutic dose.
Right, and it's naltrexone, is that right?
Naltrexone.
Yeah, and tell me about that.
Naltrexone, the medication itself is FDA approved. It's been around for over 20 years, and it essentially blocks the receptor sites in the brain that crave alcohol. It gives you the joy from alcohol and other drugs.
So in theory then, talk me through how it works. So you've had it, and now the patient is not going to crave the alcohol, not going to feel the same joy from drinking it. Is that correct?
Exactly.
Right.
And that's why this program is for someone who is physically dependent on alcohol. So it blocks those cravings.
And one of the reasons why you think this is better than a patient taking a pill is because I'm guessing that a patient probably is not that reliable in many cases, right? And they would stop taking the medication.
Well, if you keep in mind the type of patient we're treating, that's an alcoholic, they're not going to be reliable in taking a daily pill. And getting a monthly injection, is very costly, painful, and a constant thing that has to be done on a monthly basis. It's just not going to happen.
So you've done a whole bunch of these, right?
Over the last 5.5 years, several thousand.
Okay, so that's a lot.
Yes.
Give me a success story, or are they all sort of roughly the same success stories?
There are different degrees, but one in particular, a lady comes in, has the pellet after having failed many other programs. In 30 years drinking daily, after the pellet finds that she's no longer craving alcohol.
Yeah.
Is able to regain her life.
It's got to be a rewarding feeling for you as well, I would imagine.
It is fantastic.
Yeah. So we're going to bring on a doctor in a couple of moments to actually learn more about the procedure, how it works, and learn more about the facility down here to get it done. But I guess the last question for you would be, if someone's watching our show and thinking about doing it, just from the fact that you've seen thousands of these procedures, what would be the compelling reason for somebody to do this?
The compelling reason is that this is a real chance to achieve success, to finally be able to break that cycle of daily drinking. By having a medication in you that you do not have to take on a daily basis, you can rely on the medication and not yourself, really.
Ernesto, it was great to talk with you. We're going to bring Dr. Sasani on, and we're going to learn about how it works, right?
Thank you, sir.
Thank you. All right, joining us now is Dr. Sasani, who is the man that's going to break this down for us and explain how the procedure works. Welcome to the show.
Great to be here, Dave.
All right, talk us through it. How does the procedure go?
Basically, the procedure is done as an outpatient procedure. Patients come to us, they're already pre-screened by a behavioral therapist, they have a psychiatrist. They are the physicians and caregivers that make sure the patients are good candidates for this procedure. Basically, they come to the facility, they're taken care of by our nurses initially, they receive an intake, and then we discuss the procedure with them. It's basically done as an outpatient, totally under local anesthesia. The patients walk in, they walk out. They're very comfortable during the entire procedure. We keep them calm during the entire procedure. If need be, there is the ability to do some conscious sedation, so that can make them more comfortable during the procedure. But basically, the procedure involves just numbing up the area of the lower abdomen. We make a small incision. We make a small pocket into which we put the naltrexone implants, very, very small pellets that are put into this pocket, and then we close the incision, and usually it's just an inch long and fairly imperceptible over time.
How long do the pellets last before you need to come back again?
They last for a year.
Okay. And then how quickly after the procedure will the patient start to be able to notice the results?
Immediately. The craving should stop.
Wow. Wow. And then you guys, there's also sort of like an aftercare follow-up program that goes along with this, right?
Well, they're already in a behavioral modification program with their therapists and with a psychiatrist. But as far as the surgical procedure itself, they're then followed up with us just to make sure they have no immediate surgical complications,
Right.
infection and bleeding and those types of things. So they come back to our office a week after just to check their wound.
Yeah, and right, and what I was essentially asking was there's also the behavior sort of follow-up and the therapeutic angle of it follow-up as well.
Exactly.
Yeah.
There's multiple people that are helping to take care of the patient. They're in a program and making sure, first of all, like we said before, they're a good candidate for it. The surgery aspect is just one small component of the entire thing.
And the facility where you do it, the Take Shape Surgery Center.
Yeah, Take Shape Surgery Center is a facility that I opened 10 years ago, so we're very excited to be able to provide this new service. We are Medicare certified. We're licensed by the state as an ambulatory surgical center. And we have board certified physicians. I'm a board certified plastic surgeon.
And insurance-wise, PPOs will cover this?
Exactly.
Okay. And I know that this is a big deal in South Florida because this doesn't really exist at other places, right?
This is the first time it's being done on the East Coast.
Yeah.
In the state of Florida, yeah.
And not only are you going to get local business, but people, from what I understand, are going to be traveling from around the country.
People will be flying in for the
Yeah.
service, yeah.
Yeah, well,
we're very excited.
It's incredible.
Yeah.
It's really a wonderful thing for people that suffer through addiction. If anyone watching has a question, they want to follow up, they want more information, how can they get a hold of you?
They can feel free to contact SoberTime USA at the screen that's listed, at the number that's listed on the screen.
All right, Dr. Sasani, great to meet you. Keep doing what you're doing.
Thank you very much.
You got it.